For this exercise, what you're gonna do is just set up seated here, and you're gonna start with just a neutral posture here, and then you're gonna take your pelvis here and rock it forward to put your spine into extension like this. If you have limited hip mobility, you may need to alter how wide your knees are. You can try a little bit wider stance to get a little bit better range of motion into extension. The goal here is to get the hips forward enough to place the spine into enough extension to just get a mild stretch or strain. So we want to get strain but not pain. The difference between that is just bending your finger back. That is strain, but if I were to hold it there and then hold it there all day, then that would be pain. So you're just going to the point where you feel the strain and come back out of it, come back to neutral. Just to the point where you feel strain and then back to neutral. You may just feel a stretch, and then that one you can just push into that stretch and then move back to neutral. While you're doing this, you're going to be looking for a green light, yellow light, red light. Green light is your increasing range of motion, things feel better afterwards, or symptoms are centralizing. Yellow light is there's no change while you do this exercise, but it's no worse afterwards. Red light means it makes things worse, you're decreasing range of motion, or you're peripheralizing. Centralization is when your symptoms are getting closer to your back. Peripheralization is when your symptoms are going away from your back. So again, centralization is green light. So if your symptoms start at your hamstring here or your calf, and then afterwards you feel it here in the glute, then that's a sign of centralization, that's a green light. If you feel it maybe in your glute, and then afterwards you feel on your calf or your foot, that's peripheralization, that's a red light. So we want symptoms closer to the back. As long as we get green light or yellow light, you can continue this one. If you get any sort of red lights, stop this exercise, and we can reassess next session.